Good afternoon. My name is Dr. Jeremy Adler. I'm the Tippecanoe County Health Officer. I'd like to welcome you to our local COVID-19 update. Today I'm pleased to be joined by Lafayette Mayor Tony Rosworski, West Lafayette Mayor John Dennis, Dr. Esteban Ramirez from the Protect Purdue Health Center, Dr. Jim Bean from the IU Arnett Hospital, and Dr. Dan Wickert from the Franciscan Hospital. We'll begin as we usually do with a review of our local data. Just to review, the 5 data points that we have been following here locally for our COVID-19 pandemic are the number of new confirmed COVID-19 cases, the percentage of COVID-19 tests that are positive, this is also known as the percent positivity, the number of COVID-19 hospitalizations, including the number of patients in intensive care and on ventilators, the number of emergency department visits for respiratory illnesses, and finally the number of deaths due to COVID-19. This slide summarizes our cumulative county COVID-19 data. We have had just over 21,000 Tippecanoe County residents with confirmed COVID-19. In the last 28 days, there have been 889 new cases. Of note, there have been 351 new cases in the last 7 days, so about 40% of the new cases we've seen in the last month have occurred in just the last 7 days. We've had 211 deaths. That's one additional death from last time we met. There are 19,808 recovered individuals, leaving us with 1,230 active COVID-19 cases in Tippecanoe County. This graph shows our daily new COVID-19 cases dating all the way back to last March. As you can see, we underwent a significant surge in cases in November and December and early January. The number, thankfully, has decreased greatly since then. However, here in the last several days, we've seen an uptick in our new cases. That same data is represented here as an average daily new cases by week. As you can see, the number decreased significantly during January, February, and March, but has increased recently in the last week to an average of 45.6 new cases per day. Over 111,000 individuals in Tippecanoe County have been tested for COVID-19. Our current percent positivity is 4.2%. This is just below the state of Indiana at 4.5% and slightly below the nation as a whole at 5.1%. This graph shows our trends in percent positivity, and as you can see, we've also seen a recent uptick in our percent positivity to its current level of 4.2%. Last week it was 2.5%, the week before that 1.9%. So overall lower than where it was during our surge, but has recently increased. This slide shows our combined local hospital COVID-19 data. The top line are the number of patients hospitalized with COVID-19. The number currently sits at 14. The middle line are the number in the intensive care units, 5, and the bottom line are the number on ventilators with COVID-19, and that is fortunately at 0. Relatively stable in terms of hospitalization numbers, and lower, of course, than we saw during November, December, and early January. This slide shows our emergency department visits for respiratory illnesses. We've also seen a decrease recently in respiratory illness visits to the emergency departments, 104 for last week, which is lower than that number had been previously. And this last slide shows our local deaths due to COVID-19, total deaths. As you can see, we had a significant increase, of course, during the surge of November, December, and early January. Our rate of deaths due to COVID-19 has recently plateaued and has remained fairly flat for the last several weeks. This slide summarizes our K through 12 local school data. This is combined data for all K through 12 schools and school systems in Tippecanoe County. As of April 6th, a total of 1,811 cumulative confirmed cases, 77 of those occurring in the last 28 days. You can see the breakdown there below of students, teachers, staff, etc. We've had just over 11,000 cumulative close contacts quarantined, 334 of those occurring in the last 28 days. And of note, 256 of the individuals who were quarantined ended up testing positive during their quarantine period. And lastly, I wanted to provide a summary of our COVID-19 vaccination data. As of today, we've had just under 50,000 Tippecanoe County residents receive their first dose of vaccine. 27,123 have received the second dose of either the Pfizer or Moderna vaccine, or one dose of the Johnson & Johnson vaccine, making them fully vaccinated. So about 14% of our county's population is considered to be fully vaccinated at this point for COVID-19. Everyone ages 16 and older is now eligible to be vaccinated in the state of Indiana. It's important to note that 16 and 17-year-olds, however, must receive the Pfizer vaccine. That's the only vaccine that is currently approved for 16 and 17-year-olds. There are clinical trials currently underway for younger children, and the hope is that by midsummer we'll be able to vaccinate children 12 and older, and then after that, younger children. Our Tippecanoe County Health Department vaccine clinic is located at 2577 Maple Point Drive in Lafayette. The hours are listed on the slide. Of note, next week we'll begin offering vaccinations on Wednesdays from 9 a.m. to 5 p.m. So this is in addition to the other days that we are currently offering the vaccine. We are vaccinating by appointment only. Please register online at ourshot.in.gov or by calling 211. Our clinic is providing the Moderna vaccine, which is a 2-dose series given 28 to 42 days apart. We also have a small supply of Johnson & Johnson vaccine, and this Saturday, April 10th, we'll be holding our first drive-through clinic, also by appointment only, in the parking lot at the Maple Point facility. We're asking those that are registered to please enter from the Sagamore Parkway entrance for that clinic this Saturday. While new local COVID-19 cases remain lower than they were in late 2020 and early 2021, we have seen a recent uptick in cases and percent positivity. Today, Tippecanoe County is yellow on the Indiana Department of Health COVID-19 dashboard for the second consecutive week. It's important that we remain cautious and continue preventive measures to reduce the spread of the virus. Although the governor's statewide mask mandate ended yesterday and COVID-19 vaccines are becoming more available, the pandemic is unfortunately not over. Masks remain one of the best ways to prevent disease and save lives. And until a greater number of people are vaccinated against COVID-19, masks need to be worn. The Tippecanoe County Health Department is strongly recommending that everyone older than 2 years of age continue to wear face coverings in businesses, indoor public spaces, outdoor spaces where social distancing of at least 6 feet between people from different households is not maintained, and while using public transportation. In addition, the Health Department is recommending that businesses and organizations require staff, customers, and clients to wear face coverings. Updated recommendations for businesses, events, and religious organizations can be found on the Tippecanoe County Health Department website. I applaud Mayor Dennis and the City of West Lafayette, Purdue University, and local businesses and organizations for keeping their mask mandates. Their policies will help protect our community. It is also very important to continue other essential preventive measures, such as social distancing, frequent hand washing, avoiding crowds, and staying home when sick. Without masks and these other measures, we could see another surge of infections. There are now 3 safe and effective COVID-19 vaccines available to everyone 16 and older. Please get vaccinated. Vaccination is critical for our community, state, and nation to get through this pandemic. Starting yesterday, local restaurants and bars are now allowed up to 100% capacity indoors and outdoors, provided that social distancing of 6 feet is maintained. While capacity limits are no longer based on a percentage of overall occupancy, Seating must be arranged and maintained so that individuals, households, and parties are spaced at least 6 feet apart from any other individual, household, or party. Due to face coverings not being worn while eating and drinking, it is very necessary to maintain social distancing in restaurants and bars to reduce COVID-19 transmission. The Health Department will continue to monitor local COVID-19 cases and modify orders and recommendations as needed. I know that many of us have pandemic fatigue, but our actions really do matter in the fight against COVID-19. Remember to continue wearing face coverings, social distancing, washing your hands, avoiding crowds, and staying home when sick. Get vaccinated if you are 16 or older. Taking these measures now will allow life to return to normal sooner. Thank you for doing your part. That concludes all of my remarks. I'd be happy to take questions from the media and from our Facebook Live audience. Thank you.
Emily Delato with the Journal and Courier. Dr. Adler, can you kind of give your thoughts or maybe what you think some of the reasons are for the rising case numbers and percent positivity here in the county and statewide as well?
Sure, I think it's a combination of several things. I think that spring break is part of that. Our variant strains that we're seeing not only locally but across the state and across the country are part of that also. There's also, unfortunately, a lot of pandemic fatigue right now, and I think many people are getting lax about preventive measures, and that's also contributing to the increase that we're seeing.
And for Dr. Ramirez, can you give an update on the number of variants that the Purdue lab has found?
Yeah, so over the last week, we've doubled the amount of variants that we have, so we've increased the amount of variants that are present. And if you look at the national data, that's consistent with that. So we're seeing about 42 B117 cases already. And that's the one that's the most rampant in the United States at this point. So because of that, we've made some recent changes to our isolation and quarantine. We are now going to be extending that to 14 days, and that's based on the new literature that's suggesting that there's a longer shedding period perhaps for some of these variants. So we want to make sure that we kind of are, we can encompass that time frame as best we can at this point.
So based on the numbers that we're seeing, you know, I think you're kind of already alluding to this, but are we seeing, or in the beginning of another surge, and what does it mean that we're seeing these increasing numbers with the mask mandate, I guess, still in place, the numbers that we kind of already are seeing? Yeah. You know, I think it's probably too early to call the uptick that we're seeing a surge. There is, obviously, as was shown on the slides, there have been more new cases in the last week than in the previous weeks, but still lower than what we saw towards the end of 2020 and early 2021. So too early to refer to it as a surge. We hope that that upward trend does not continue. We do not want another surge at all. We'd like to see that number go down, of course. And the second part of your question, I'm sorry, I forgot what was the second part. I guess what does it mean that we're seeing those numbers increasing? And those numbers, I think, would be from a time when mask mandate was still in place. And so what does that tell us about a mask mandate going away? Sure. You know, I think that it makes me concerned that the numbers could increase as fewer people may be wearing masks now that the statewide mask mandate has gone away. Clearly, you know, the surge that we had in November and December occurred while there was a mask mandate. So the virus, you know, is able to spread very easily, and every layer of protection, every step that we can take to reduce that spread, including using masks, should help to prevent another surge. You know, is there any concern that with this, you know, the messaging that we're getting from the state, the lifting of the mandate, there's going to be a confusion for the general public to think that the pandemic is over? Yeah, and clearly it's not. You know, the pandemic is not over. We're still seeing people getting COVID-19. Some of them are of course, ending up in the hospital with it, so they're quite ill from it. We're seeing an increasing percentage of cases in young individuals. About 51% of our county cases are in people ages 29 and younger. So certainly the pandemic's not over, and I hope that people do not interpret the governor's mask mandate being removed as a sign that the pandemic is over, because we clearly need to keep doing what we're doing to prevent the transmission of this virus. We just don't have enough people vaccinated yet, and there will be a day when we will have enough people vaccinated, but we're not there yet. So we need to continue all of these other public health measures that have helped keep things under control.
Yeah. Mayor Rosworski, wow, I'm so sorry. I spent Monday talking to a lot of businesses in the downtown area. Many of them plan to keep mask requirements in place for a little while longer, at least until their staff can get vaccinated, but noted it's difficult to enforce a mandate without a state or a local one. Can you talk about why Lafayette chose not to keep a mandate in place?
Yeah, I mean, we chose to follow the governor's recommendation and make an advisory. We know that there are going to be businesses and restaurants that want to keep those mask mandated in place, and we certainly appreciate that, and we understand their right to do that, and we want to encourage people to be respectful of that and to wear their mask when they go to those locations, and be respectful of that decision that that individual business had the right to make. Some of them are making that, some of them are not. But the ones that do, people should respect that, and we want to make sure that people are wearing their mask during times when they can't socially distance and do some of those other things, be respectful of high-risk populations. But we felt it was proper for us to follow the governor's recommendation and let individuals begin to make, and businesses make those decisions for themselves. And, you know, that's the decision we made, and I'm sticking with it.
Yeah, and can you maybe talk about why it looks like City Hall is going to keep a mask mandate in place, but then I guess, so why there but not for the city as a whole?
Well, that's an individual decision that we made as local government to keep the mask mandate in place for a couple more weeks, and that follows along what the governor did. He's requiring masks to be in state buildings, and so we're trying to remain consistent. I think it's also important that the governor, I think, went overboard in saying that he doesn't believe that the pandemic is over, and that, you know, we should throw all caution to the wind. I think he's done a good job explaining his decisions and leading the state through this process that we've been in, and I think he's made it abundantly clear, as some of his staff, that he doesn't believe that it's over. And I think, unfortunately, people will hear what they want to hear regardless. But I think he's done a good job of explaining that also, but why he made this decision to do this at this time.
Emily Seibert with WBAA. I did want to, Dr. Adler, ask just really quickly, since you're having this Johnson & Johnson drive on Saturday, are you able to talk about the possible impact for the county if there's a possible disruption in the supply of Johnson & Johnson, since we have a kind of a group of spoiled doses right now, and there's a little bit of uncertainty about that?
Yes, that issue with the Johnson & Johnson vaccine should not affect our drive-through clinic this Saturday because we've already received our doses for that. It may impact, of course, our future Johnson & Johnson supply, but we are set for this Saturday.
Okay. And I know in the past you've often cited the 5% testing positivity rate the World Health Organization has set. And our 7-day all test positivity rate has obviously, as you were mentioning earlier, been going up quite a bit. I guess, when are we possibly going to hit 5%? You know, how closely are you watching that number? And then if that continues to go up, when are you going to start possibly putting some restrictions back in place?
You know, it's hard to predict, you know, if and when that number will reach 5%. We watch it daily, and it can change from day to day, and sometimes pretty significantly. You know, I think that the decision about, you know, other sorts of restrictions doesn't just depend on the percent positivity, but on other factors also. We don't want to have to go back to where we were before with more restrictions. We're hopeful that everyone will continue to do the right things and we can get more people vaccinated and start to see those new case numbers and our percent positivity move in a downward direction and not necessitate other measures being taken.
And this is, I guess, kind of for anyone. I mean, this group has kind of worked together over the past year to kind of, essentially kind of decide what's happening locally with COVID. Could you just kind of explain what the setup is right now as we're moving into kind of a new phase? Are you meeting? How often are you talking? Just to give us an idea of how, for example, Montgomery County, I think, sent out like a press release from a group of people that said, this is what we're doing. From the county, from, Crawfordsville. So I was just curious, how are you communicating right now, and then how will you communicate as a group going forward?
Sure. Thankfully, we've had very good communication since the beginning of the pandemic, and many of us talk quite frequently and exchange information, run ideas past each other, ask a lot of questions of each other. So we have very open lines of communication, and I would expect that those lines of communication will continue to be open, and we'll be watching our local data closely and making whatever decisions need to be made to keep everyone here safe.
Okay. And then I guess my last question for Dr. Bean and Dr. Rickert, how are the hospitals feeling? How are things going right now, and what are you possibly thinking about and preparing for in the next couple of weeks and months?
Let me spend a minute talking about your previous question also. So at Purdue and Dr. Bean's leading, we have been meeting right now 3 times a week. We meet at 9:30 in the morning on a Teams call with representatives from Purdue, the County Health Department, and both hospitals. So talking about what's happening in each institution, each area, and making plans together. And I think that's really been a very important component of what's happened to strengthen bonds and relationships and the ability to communicate with one another and to be transparent and open with what's happening. So I think it's been a very, very positive meeting that's happened, and I want to thank all who participated in that. That's been really, in my opinion, a very good thing that's happened, and really brought us all closer together as opposed to being competitors or doing our own thing in a silo. So I think it's been very important. From a hospital standpoint, our numbers, of course, are down, and we're very happy about that. So we would never say anything bad about that. We're happy about that. I'm sure that we'll probably, both of us will have to live with some element of positive individuals in our hospitals for the foreseeable future. So, but right now we had 6 positives and a number of rule-outs. People were waiting for testing results to come back. So we're doing well from that standpoint. I think the challenge at the hospital right now is that it's not COVID patients, it's just everyone else who's ill that's filling up our hospitals and filling up our ICU beds. So we tend to think, or the past year we thought, well, everything is just COVID. Well, that's not true. And so we're seeing individuals who are ill from other reasons besides COVID. So the hospitals are both busy and full at this point, and so we're managing that on a daily basis as to providing care for those individuals who are coming in. And there are certain days, we had a meeting this morning, we talked about, well, we've seen some more trauma cases. Is that because the weather's good and people are outside doing things they maybe otherwise wouldn't do, and now we're seeing some more trauma? I mean, so all those variations happen in our county and in our city, and they kind of have an impact on the hospitals at some point also. So it varies. I think Tuesday night at Franciscan, we really had a large number of admissions. That's not every day. There's a cyclic element to that, and you never know exactly when it's going to happen. So that's what you prepare for.
Yeah, I'll just add a couple points. I too think that the weekday conversations that we started having and now are 3 times a week across the 4 entities that Dr. Wickert identified has been really helpful, not only in helping us individually kind of prepare for and respond to the pandemic, but also helping us as a group of colleagues understand what our guidance would be for community leaders and for future conversations. We now have the communication lines wide open, and so that I think gives me confidence that going forward we'll have a community that's well integrated in responding to public health concerns. The other thing I'll just point out, I'll take this moment to point out, it's National Public Health Week, so I want to extend a really heartfelt thank you to Dr. Adler and Kayla and their team at the County Health Department for their leadership, guidance, commitment, all in support for the work that's happened throughout the county over this past year and before and beyond. I think that the work they've done has often gone unrecognized and behind the scenes, and has been really impactful. So great appreciation to their team. From IU Health RNet's perspective, very similar story from a hospital status. We are busy, but our COVID patient numbers are down from where they were in the peak. We have 5 this morning, and within our regional hospitals, a total of 8 COVID positive patients across our 3 regional hospitals. I am concerned that the healthcare workforce that has lived through this continues to be at risk. It's hard work, and that's not the issue. People work hard and are resilient in that regard, but to be witness to so much suffering for such a long period of time and to have on the horizon perhaps more coming is an emotional drain for many. And it's not uncommon for me, when I talk with colleagues who are really on the front line, to encounter people who are very close to tears and who appreciate the opportunity for a conversation because it allows them to share what they've experienced. So our healthcare workforce is strong and is resilient, but they are bearing a burden that many are not aware of, and I just wanted to bring that to the community's attention as well.
Question from Facebook Live. With the prospect of a 4th wave on the horizon, why are your briefings coming to an end?
We're going to continue to provide updates on our local data and our local COVID-19 situation through our Facebook page and through the County Health Department website. Certainly, if we do, and hopefully we won't, if we do experience another surge, a 4th wave, then of course we may need to reconvene the press conferences.
And for Dr. Adler, you mentioned the clinic is having a drive-through this weekend. Have you heard any chatter or had any conversations with the state about a mass vaccination clinic coming here? We've kind of been left out. This region of the state has been left out so far.
Sure. The State Department of Health did host a mass vaccination clinic here locally, I believe 2 weeks ago, for 2 or 3 days at the Riverside Community Church. And I have not heard whether the state is going to be hosting another mass vaccination clinic in Tippecanoe County. Kayla, have you heard anything from the state about that?
I think it depends on the Johnson & Johnson supply right now, right? So all the rest of it's pretty much saved for the mass clinic at the Speedway that's ongoing. And so we were lucky to get what we got. And then also most counties that have like homeless population received J&J for that. And then J&J will also be used for like DOCs. So it kind of depends if there is more J&J available to do more.
And kind of on that note as well, you have the clinic this weekend. Do you plan to have recurring clinics after that as well?
It all depends on vaccine supply. If we get more Johnson & Johnson vaccine and if we have a successful clinic this Saturday, then certainly that's certainly a possibility. Yeah.
Hi, Natalie Fedor with the Purdue Exponent. My question's for Dr. Ramirez. The increase in variants that we've seen on Purdue's campus, are those coming from like any specific groups on campus, such as like Greek life or dorms?
No, actually, a majority of our students that are getting that particular type of variant seems to be off-campus students. So it isn't really associated with a particular, fraternity, sorority, or co-op life. We have had a couple there, but it's not been the majority. So I'm thankful for that, because I think it might be a different picture otherwise.
Right. Are we going to be testing more as more vaccines are like given out on campus? Are we still going to maintain the consistent testing, or will we be lowering that at all?
Sure. So first of all, we're really pushing hard to get everyone vaccinated. We started our clinic just yesterday at noon, so we're super excited. We got 2,200 individuals vaccinated. So we were very happy with the turnout and with the amount of volunteers. So we're very thankful for that. As you're aware, the CDC has put out guidance on changing who needs to be tested, who needs to be quarantined after travel, domestic, international. So we're going to reflect that as well eventually, but we want, just like Dr. Adler mentioned, a higher critical mass of folks who are getting fully vaccinated. Once we reach that threshold, we'll start kicking in those particular types of decrease in restrictions.
Okay. And do we know what specific variants have been found on campus?
We've had the B117 is by far the most common. We have a couple California variants, a couple New York variants, one South African variant, and a P2 variant, which is not the main one. The P1 is the Brazilian variant, but P2 is kind of like a cousin that's associated with it, so we're just keeping an eye on that one. And all of these particular types of variants, we report to the state to make sure they're aware, and they report to CDC. Mm-hmm. So we kind of have this really close relationship and communication to make sure we're following the best guidance that's out there for these particular types of variants.
And are they mainly being found among students?
Yes. Actually, I would say probably 99% have been students.
Okay, gotcha. And then for Dr. Adler or whoever else, is the city planning to do anything more to promote vaccination among minority populations?
Yes, we are actively working with our minority coalitions, minority groups, to get the word out to minority populations that the vaccine is important, that it's safe, it's effective, that it is one of our greatest tools to get through this pandemic and to get back to life as it was before, normal life, which is what we all want.
Mm-hmm. Okay, thank you.
So that was part of the Riverside City Clinic too. That was the minority coalition that partnered with the state to bring that clinic to our community.
Okay.
And just one sort of anecdotal point to that, our senior population has also had some degree of reluctance, and we've done a great job in making sure that they're aware that it's safe and it's worth their time to get a vaccination.
Another question from Facebook Live. Given the presence of variant strains, are we going to see new restrictions modified?
It really depends on case numbers and percent positivity, hospitalizations, deaths. All of the data points that we review here all go into decisions about those sorts of things. Our hope with the variants is that we don't have a surge, that we don't need any additional sorts of restrictions or measures. But we're watching that closely, and we're going to continue to base our decisions on our local data.
Another question from Facebook Live. This is a two-part question, one for Dr. Ramirez. Is Purdue only sequencing positive cases from Purdue, or are they sequencing county-wide cases? And if not, who is sequencing the county-wide cases?
Yeah, so we sequence all S drops. So anyone who, so B117 has this particular pattern where it doesn't register an S, particular type of component, which that S drop then triggers immediate sequencing, because the likelihood is that's probably a B117. We also do random sampling of our positives because these other variants that are out there, they don't give us that S drop. So we have no way of knowing if they are the variant or not unless we test them. So we try to figure out what our capacity was with the genetic sequencing lab that we work with, and we set up, I think it's a 10% sampling, random sampling that we're currently doing. With regards to who sequences the county, I'll refer to Dr. Adler for that.
Yes. Yeah, so for county tests, the sequencing falls under the State Department of Health's surveillance system that they have in place for variant strains. And that system involves a combination of random sampling of a certain number of test specimens per week, and then also some targeted testing of certain cases that there's a high suspicion of a variant. So it may be somebody who is hospitalized or somebody who has been reinfected with COVID-19, somebody who's had a breakthrough infection, that's an infection after being vaccinated. So those are other things that would raise a red flag and could trigger sequencing for variants through the state's surveillance system. If there are no further questions, I'd like to thank all of you for attending. Have a good day.